Weekly briefing for Wednesday, the 31st of March, 2021. I am Lesroy Williams. Thank you very much for joining us for our briefing today. As usual, your company is appreciated as you continue to be vigilant in terms of what is happening with respect to the COVID-19 pandemic, and we continue to update you with respect with what is happening in the Federation. Of course, the pandemic is still with us. It is not over, and therefore we continue to manage as best as we could the pandemic. We are in Holy Week, which is basically one of the holiest weeks in Christendom, when of course we are going to see the culmination of the story of Jesus Christ of Nazareth. We are going to see the betrayal. We are going to see the deceit. We are going to see the denial, the false witnesses, the violence, the execution. But of course, we are also going to see the resurrection and the triumph of good over evil and light over darkness. So we are in that time of year. It was last year, of course, we were in the lockdown and the curfews and so on, and people could not really attend church during such a solemn time in the life of Christianity. This year, it is different, and it is all because we have managed very well the COVID-19 pandemic. And so therefore, people this year will be able to go to church and to participate in these very important events of the church over the coming days. I would invite Superintendent Cromwell Henry, who is a member of the National COVID-19 Task Force, to give us his presentation. Superintendent.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast. As we approach this religious holiday weekend, we are seeing an increase in the number of applications for social events. Currently, we have over 70 applications for events over this holiday weekend, social events, that is. So today I will speak briefly on what the law says about mass gatherings or events. The COVID-19 Prevention and Control Act defines an event or a mass gathering as an event where the number of people it brings together is so large that it has the potential to strain the planning and response resources of the health system in the community where it takes place. A cap on the number of persons who can attend mass events or social gatherings is currently in effect. In the context of COVID-19, mass events are categorized into three categories. One, small events. These are events with 25 to 50 persons. Medium events, 50 to 100 persons. And large events, 101 to 150 persons. It is important to note that the more people an individual interacts with at a gathering, and the longer that interaction lasts, the higher the potential risk of becoming infected with COVID-19 or spreading COVID-19. Persons wishing to host events are required to make application to the Commissioner of Police via the website police.kn. It is important for me to add here that beach parties, which are usually prevalent on holiday weekends, and picnics are restricted, particularly where music is involved. So no permission will therefore be granted for these type of activities. Beach parties and beach picnics, especially with music, would not be permitted on the beaches. The Commissioner of Police will factor in music, dancing, sale of and use of alcohol, and the duration of an event in making his decision to approve or not. Consideration will also be given to whether or not the event is indoor or outdoor, with a more favorable look on outdoor events with a maximum of 150 persons. Permission will not be given for any indoor large event of over 100 persons, as the risk of virus spread is greater in these situations. Notwithstanding these maximum numbers, the size of the venue will determine the number of persons permitted. A minimum of 30 square feet per person will be required for adequate social distancing. Event locations will be visited by the police or the compliance task force to determine if the conditions of the permit are being adhered to. Non-compliance will attract corrective measures. So as we go through this Easter holiday weekend, let us be reminded that COVID-19 still poses a threat to the Federation. And so we should continue to adhere and be guided by all the non-pharmaceutical measures prescribed by the law. You should continue to wear your mask when in public places, maintain a physical distance of 6 feet, sanitize frequently, and avoid crowded places as much as possible. Thank you.
Thank you very much, Superintendent Henry. I now invite our Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operations Center Situation Report.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. This afternoon, again, it's my task to share with you the Health Emergency Operating Center's situation report for today, Wednesday, March the 31st. Now, St. Kitts and Nevis, the Federation, would have reported 44 confirmed cases of COVID-19. 43 of these 44 cases would have recovered completely, and so at present we are only monitoring one active case who remains stable. Now, based on the World Health Organization's COVID-19 dashboard, over 127.9 million persons have been impacted by this disease, and over 2.8 million persons have died. And many countries the world over are presently administering the COVID-19 vaccine. And so to date, over 520.5 million doses of vaccine, COVID-19 vaccine, have been administered. In the United States of America, over 30 million persons have been confirmed with COVID-19, and over 551,000 deaths have been reported from this disease. In the Caribbean area, the number of confirmed cases continue to gradually increase, and so within the CARFA member states, there are 135,305 confirmed cases and approximately 2,204 deaths. We like to focus a little bit more on the Eastern Caribbean states, and you can see the case count with over St. Lucia having over 4,000 cases, Barbados over 3,000 cases. Now, in terms of the vaccine rollout, all of the Eastern Caribbean states, they are now, rolling out their vaccine program. Now, in Barbados, they would have administered 22, they would have covered 22% of their population with at least the first dose of the AstraZeneca Oxford vaccine. Same thing in Dominica, they would have administered or covered 22% of their population with at least the first dose of the vaccine. Grenada stands at 8.8%. Now these rates were accessed on the New York Times website. Now the other numbers, the raw numbers, just the numbers of doses administered. So Anguilla would have administered 5,510 doses, Antigua and Barbuda 26,424, St. Lucia over 21,000, St. Vincent and the Grenadines over 10,000 doses. This just gives you an idea as to the status of vaccination in the Eastern Caribbean islands. Next. Now, St. Kitts and Nevis, we would have launched our COVID-19 vaccination program on Monday, February the 22nd. That's 5.5 weeks ago. And in that time period, we would have administered, and this is based on the data that just came in a few minutes ago. And so up to yesterday, the number of doses administered, 8,984. But as at this afternoon, 4:30, we would have administered 9,241 doses in the Federation. So in other words, we have reached 27.9% of our target population. Now, just by way of comparison, what's happening in terms of vaccination in the United States? Well, let us first note that the United States, they rolled out their vaccination program in late December 2020. So to date, they would have administered at least one dose to 29% of their population. And this is over a number of months. And they have only fully vaccinated 16% of the U.S. population. So this just shows that we have done quite well. In just 5.5 weeks, we would have administered at least the first dose to 27.97% of our target population. Now, in terms of testing, we continue testing. All persons who exhibit COVID-like symptoms, they are tested, and all inbound passengers are tested, and persons who are traveling at this time, COVID-19 testing is a requirement. And so to date, we would have tested 12,381 persons federation-wide, with a positivity rate of just 0.3%. So as I said before, we are only following up one active case, and in terms of quarantine, we would have started our quarantine process from as far back as April of last year, and to date, 6,785 persons would have been officially released from quarantine. Okay, based on our last poll regarding COVID-19 vaccination and the level of hesitancy, so the persons who participated in this poll, they would have cited some factors as to why they are not yet ready to accept this vaccine. And one of the factors speaks to the skepticism as it relates to the speed at which these vaccines have been developed. And so this slide speaks to or shows that the COVID-19 vaccines, the development of COVID-19 vaccines really started decades ago. Now you may ask, how so? Now, in 2003, if you recall, we had the SARS outbreak in the eastern countries, and then in 2012, we experienced the MERS outbreak. Now, the SARS and the MERS were all caused by coronaviruses, and so the scientists started working with the coronavirus way back then in an effort to develop an appropriate vaccine against this family of viruses. And so it came to the crunch last January 2020 when the SARS-CoV-2 virus was isolated, decoded, and then the genetic material or information was shared with the scientists. And so at present, you have as many as 9 manufacturing companies producing COVID-19 vaccines. So in essence, work on these vaccines didn't just begin in January last year. They began way back. Work started as far back as 2003. And so highly sophisticated technology is now available to facilitate vaccines at this rate. And so at present, we have as many as 83 COVID-19 vaccine candidates in clinical trials. Of these 83, 15 have reached phase 3 trials and 5 have reached phase 4 trials. And 13 of these vaccine candidates have achieved or attained different levels of authorization from some of the leading regulatory bodies across the globe. But most importantly, the World Health Organization have only approved 4 so far. 1, the Pfizer-BioNTech vaccine, the AstraZeneca Covishield vaccine, the AstraZeneca vaccine produced by the SK Bioscience South Korea, and then the Johnson & Johnson vaccine. So these are the 4 leading vaccines. They have achieved WHO emergency use authorization. So the speed at which these vaccines have been developed is not because of shortcuts made, but because of advancement in technology and also because of financial investments. Over 190 countries have signed on to the COVAX facility, which is a global mechanism, and each country who signed on to COVAX, you had to pay a down payment. And so these the funds have been invested in these 9 manufacturing companies, and thus you have as many as 83 COVID-19 vaccine candidates. Now, the vaccine that we are offering to our people is the AstraZeneca Oxford vaccine. And so another important question asked by our people is the safety and efficacy. And so the Ministry of Health has confidence in this vaccine in terms of its safety and its efficacy. The data coming out of the various trials tells us that it provides, once you're fully vaccinated, you enjoy an 83% risk reduction in contracting symptomatic COVID-19 infection. Now, in our federation, we are utilizing the dosing schedule whereby we give you the first dose and you are given a 10-week appointment to return for the second dose. So we are administering 2 doses 10 weeks apart. We are offering it to adults, persons over 18. And then we also want to underscore that this vaccine seems to be quite effective against the UK variant, and it also provides some protection against the variant identified in South Africa. The side effect profile is quite good. There are minimal side effects. I'll explain or I'll reiterate what some of these are. But I also want to say that the vaccines we are presently administering, they were manufactured by the Serum Institute of India, which is a reputable company, This company is responsible for manufacturing over 90% of the vaccines that are already accepted, approved, and utilized worldwide. And so for me, this was very reassuring. Now, in terms of the post-vaccine symptoms, of the 8,000, 9,000 persons locally who would have already received the first dose, quite a few persons say, hey, no symptoms, no post-vaccine problems at all. Some complain of tenderness at the injection site, some complain of chills, mild fever that's relieved by ordinary acetaminophen or paracetamol tablets. Some complain of lethargy, feeling malaise or fatigue, and mild headache. So the side effect or the side effect profile is quite favorable. Now, we heard about 2 weeks now, of some cases of individuals who would have received the vaccine and experienced thromboembolic events in Europe. Now, since then, and let's be more specific, March 22nd, 2021, we had data coming out of the United States of America, Peru, and Chile, whereby there were over 32,000 persons participating in one of their phase 3 trials. And the data was quite favorable and confirms that there is a 74% efficacy or effectiveness in preventing active COVID-19 infection. Please note that in this phase 3 trial, the participants received 2 doses of the vaccine. However, the dosing interval was only 4 weeks. And I want to underscore that the World Health Organization has already advised us that the efficacy increases to 83% if you increase the dosing schedule to an interval of about 8 to 12 weeks. The data also confirmed that there is 100% effectiveness against severe disease and hospitalization, and there wasn't any information in this trial to suggest that there is an increased risk of thromboembolic events in any of these participants. And so again, from our perspective, the AstraZeneca Oxford vaccine is safe and it's effective. Now, access to the COVID-19 vaccine, as you are aware, we would have received an initial 20,000 doses of this vaccine so far. And so the Ministry of Health, we are aiming, or our target is to reach the first 10,000 persons with the doses that we have in hand by April 16th, 2021. Now, the Federation, we are expecting another shipment of AstraZeneca Oxford vaccines by mid-April. And so we are expecting our allotment from the COVAX facility in this shipment. So we are expecting 21,600 doses, and so we will be targeting an additional 10,800 persons with this next shipment. Now, there will be, we will require more vaccines, and so the Federation is doing all it can in terms of accessing the additional doses of vaccines required. It's important to note that access to the COVID-19 vaccine is crucial to curbing the spread of the COVID-19 infections. Overall, our overall aim is to reach herd immunity, the herd immunity threshold of about 70% by summer of this year. So let me just explain, 70% of our population are adults, and so our target is our adult population, and we are hoping to be able to vaccinate our adult population by summer of this year. Once we reach the herd immunity threshold, those amongst us who are vaccinated will provide indirect protection for those who are not vaccinated. And this group would include our children who are under 18 and those adults who have other conditions and who are not able to take the vaccine. Ladies and gentlemen, I am asking you to get the facts, be empowered in terms of making an informed decision with regards to accepting the vaccine, the COVID-19 vaccine. It's our best shot at protecting ourselves, the best shot at protecting our families and loved ones, our best shot at protecting our community and building our economy. It's Easter. It's the Holy Weekend. We have 2 public holidays, and there are a number of functions planned. And so it would be irresponsible of me not to remind you of the prevention and control measures for COVID-19. Now, persons are saying we do not have the virus here. Ladies and gentlemen, we are not absolutely sure. And so you need to protect yourselves. Always wear a face mask when in public places, when you're attending any function. If you're going to your neighbor's house for a get-together, please wear your face mask. Always maintain hand hygiene. Make sure your hands are clean. Walk with your hand sanitizer. Maintain 6 feet distance between yourselves and others when you are attending any event whatsoever. Happy Easter. Thank you.
Thank you very much, Dr. Laws. I now invite Mr. Abdias Samuel, Chair of the COVID-19 National Task Force and the National Disaster Coordinator, to give us his presentation. Mr. Samuel.
Thank you, Mr. Williams, and a pleasant good afternoon to all. Today, I would like you to join me in reflecting on what would have occurred 1 year ago today. The Honorable Prime Minister would have indicated that St. Kitts, the Federation of St. Kitts and Nevis would have gone into a 24-hour lockdown. And this began on the 31st of March 2020. On the 29th of August 2020, all curfews were lifted in the Federation of St. Kitts and Nevis. Then, on the 31st of October, our borders were opened. Our borders were opened for international and commercial travel. Ladies and gentlemen, we have been making strides. I want to remind persons that are desirous of entering the Federation that you must complete the KNA travel form. And let me encourage you to read the health and travel protocols while completing these forms. Persons who are non-citizens of the Federation of St. Kitts and Nevis, and you arrive here without the necessary documentations, you may face the possibility of being repatriated to your place of origin. As my colleagues before me, I want to make a special appeal to persons, organizers, planners, entertainers, as we go into the holiday weekend, to ensure that you practice the necessary non-pharmaceutical measures and ensure that you protect yourself, your institution, workers, staff, and by extension, your citizens. Please do not lose focus of these measures. Since our borders have opened, and I want to make this point to you, since our borders have opened, 5,130 persons Again, let me repeat, 5,130 persons have entered in our federation, into our federation. The CMO has indicated we have had 44 confirmed positive cases, 43 of which have recovered. And ladies and gentlemen, that is significant. The reason why I'm giving you these statistics is because persons that keep asking and complaining, why are we just telling them about the vaccine? I could vividly reflect that Dr. Wilkinson, the chief medical officer, would have said earlier in our interministerial briefing that we would have had last year, February in 2020, that the only way for us to get out of this pandemic will be through vaccination. And that message was consistent all throughout 2020, and it was heightened in 2021. Ladies and gentlemen, the vaccination is not about a political matter. It's a Abdia Samuel matter, doctors matter, task force matters, or government matter. Is a treatment is the only way we are going to get out of this. We have to accept our consequences for not following the science. And we are seeing it in our tourism sector. We are seeing it in the entertainment sector. We are seeing it in the manufacturing sector. We are seeing it with the number of unemployment. We are seeing it in the agricultural and fishing sector. We are seeing it in the construction sector. And we also are seeing it in the sporting sector. You have that responsibility, a personal responsibility. So you have to decide if we are going to go into a peril of running St. Kitts and Nevis into, into starvation, socioeconomic starvation. That's the reality. This is no blame, so nobody blame the CMO. Nobody blame Dr. Wilkinson, Mr. Samuel. Don't blame the government, don't blame the business places. You have to take responsibility. We have to reach different segments in society. The complaints coming in, our persons are saying, oh, the businesses are trying to bribe me. Or if I don't get this, I won't get that. If I don't take the vaccine, this won't happen. What is the reality? Cruise ships will not come unless we have persons reach a certain level of vaccination. Soon and very soon, you're going to have a vaccination passport in order to travel. In my first time going to Colombia on duty, I couldn't make it. Why? I didn't have the yellow fever shot. And I couldn't find 10 persons to take the yellow fever shot with me. And I was so excited to go to Colombia. The next year around, when the opportunity came about, I had to find 10 persons to take the yellow fever shot. And when I reached to immigration, I had to show that I had my yellow fever card. That's the reality. It's an existing mechanism. This is not because of just this COVID. It's an existing mechanism. And this is how the world is going to transition going forward, because everybody wants to protect their federation or their country. Citizens and residents, we're going to have to decide or take a personal responsibility whether we go into this socioeconomic starvation, or we are going to support the science, roll out, take the vaccine, and return St. Kitts and Nevis to a state of normalcy. We have to reach different segments of society. We saw that the certain persons are making different PSAs via videos and so on. And is it an effort to reach the different bases? We have the religious basis. We have the social basis, there are persons who want to jump up. We have those who basically love certain forms of entertainment. There are other persons who love different things. We have to reach everybody. Ask yourself, what have you done to encourage someone to help us to reach herd immunity? And that's the question. If you don't believe in it, you don't believe in it. But if you believe the science and what we have done so far, based on the statistics that we just presented, then you have to do something. The complaining is not going to help us. The complaining is not going to help us. Victimizing people is not going to help us that are trying to do their best. What is going to help us if we come together as a nation and we do our best? I want to, at this point in time, to thank the political leaders of the 5 political parties that stepped up to the plate and represented here in the meeting that we would have had yesterday afternoon at NEMO headquarters. I thank them for taking the time out to come and have this discussion with us, where they shared their views, their opinions, gave feedbacks and recommendations as to the way forward in getting St. Kitts and Nevis into a state of normalcy again. Ladies and gentlemen, this cannot be done by no one person, no government. This cannot be done by a business place, institution, or no fraternity. It has to be done by all of us. Thank you for listening. I want to wish you a happy Easter, and I am hopeful that by next week we can reach 30%. By the following week, we reach the 40, then we reach the 50, the 60, the 70, and then what happens then? We will see the lifting of the restrictions. Just as you saw, we started on the 31st of March, full lockdown, and by the 29th of August, we were out of full lockdowns. Ladies and gentlemen, let us have a timeline where we're going to restore St. Kitts and Nevis to the state that we were in, with having 1 million cruise passengers, having hundreds of thousands of airline passengers into the Federation. The choice and the responsibility is of all of us. Let us be responsible. Thank you very much.
Thank you very much, Mr. Samuel. That brings us to our question and answer segment. The first question goes to Dr. Wilkinson. Dr. Wilkinson, why is the speed at which the vaccines were developed not a safety concern for you? This concern is what has me hesitant about taking the vaccine.
Thank you, Leslie, and that has been a genuine concern for a number of persons. But let me tell you why it's not a concern to me and for most persons. When a vaccine is coming to market, there are 3 main hindrances that they find. Number one, the financial hindrance, because there is not a lot of interest in the development of vaccines, and because not a lot of money is made from them. 2, there's usually a shortage of volunteers who are willing to go into trials for these experimental vaccines. And 3, there's usually a shortage of disease to test the vaccines against. As it relates to the COVID-19 pandemic, number one, there are a number of first world countries that put millions or billions of dollars upfront to the drug companies so that they can help in the development of these vaccines. 2, there was no shortage of persons who were volunteering, since most of the persons in the UK, North America, Europe, they were facing severe disease and death, such that that was an impetus for a number of persons to step forward and volunteer to take the vaccine. And thirdly, there was no shortage of disease to test the vaccines against. And so for those 3 reasons, the vaccine trials were able to move forward. Another reason is that these vaccines, they were tested in thousands of persons, more than any other vaccine in the past. And lastly, as the CMO just explained, the technology was nothing that was new. The technology used for the AstraZeneca vaccine has been used 10 years ago in the SARS outbreak. and the technology for the Pfizer-BioNTech vaccine has been under investigation for the last 3 years. And so for all those reasons, we know that the vaccine is safe, and so that is one of the reasons why I didn't hesitate to roll up my sleeve and take the vaccine.
Thank you, Dr. Wilkinson. This next question, if you have a sports event and the officials and teams do not amount to 150 persons, can some spectators be allowed to reach them in order for the maximum of 150 persons to be reached, which includes the officials? Superintendent.
We will be running a risk if we do that, because we do not know if or when those officials would show up for the game. If we say, for example, there are only 100 officials here, so let's take 50 spectators, and then later the other 50 officials show up, we are over the maximum number allowed. So we would not take the risk to say that we could make up the difference with spectators. The officials could give us that number, and so we will stick to that number.
This next question is for one of the medical doctors in the room. I am 72 years old. I have been living on one kidney for the past 28 years. Recently, I was diagnosed with high blood pressure. Can I take the vaccine?
One of the things we've said is that there are some persons who would do much worse if they were to get COVID-19 disease as compared to the side effects from the vaccine itself. And so despite the fact that the person is saying that they have one kidney, that is not a contraindication to taking the vaccine. 72 is still a very young age, and so yes, my final advice to you would be to check with your doctor so that you can get the details as to what your health status is. But just hearing that alone, those are not any contraindications to you taking the vaccine, because without the vaccine, if you were to get the disease, you would, you may not fare well. Thank you.
Thank you. Our next question, why is there an apparent rush to get persons vaccinated in the Federation? We have no COVID, well, we have one case, active case, and I would like to wait until we get a more effective vaccine. Dr. Wilkinson.
Yes, there is a sense of urgency. We're in a crisis. We're in the middle of a pandemic. And despite the fact that we don't have any community spread here in the Federation, despite the fact that we do not have any deaths, there is a sense of urgency. And the longer you wait, if the longer the virus circulates, the more mutations will occur and the more variants will develop. And if we can get persons vaccinated now and eliminate the virus, we can eliminate COVID-19. The longer we hesitate, the more variants can develop and the longer the disease will stay with us. And so, yes, there is an apparent rush. Yes, there is a crisis. Yes, there is a sense of urgency. And there is no need for complacency, because we've said before, inaction and complacency can be just as dangerous as the disease itself.
There is a sense of urgency, because if we do not, it's just a matter of time before we have clusters of cases and the community transmission of the virus. And so if we get our people vaccinated, you prevent clusters and community transmission. And so that's why there is a sense of urgency.
This question is from Von Radio. We have learned of the COVID-19 variant now making its way to the island of Grenada. So this tells us that the virus is possibly making its way to other Caribbean islands. If in the event it reaches here in the Federation, are there any plans that the task force has to slow the spread if needs be? And also, how potent would the Oxford AstraZeneca be in fighting this new variant?
Thanks for the question. Now, one of the things that we attempted to do from very early was to keep the virus at bay as long as possible with our stringent entry protocols. And because of that, we have not had any community spread to date, but we keep saying that it's only a matter of time. Okay? We also said that we needed to hold strain until a vaccine arrived, because it was only a vaccine that was going to get us out of this crisis. We have a vaccine now. And so the thing that we have in place is the vaccine. And that is why we're encouraging persons to move forward and take the vaccine, because it's only a matter of time before the virus arrives and it gets into the community. And so how we will stop the development of community spread, how we'll stop the variant, is through the vaccine. And right now we know that the vaccine is effective against the variant. And so to answer the question to the person posing the question from One Radio, we need you to encourage persons. Every time you go to your mic, you encourage persons to step forward and take the vaccine, so that when the virus does arrive here, it will be stopped dead in its tracks, because the persons at the ports of entry, they would have been vaccinated. If it got into the community, most of the persons in the community would have been vaccinated. If it got into the church, most of the persons in the church would have been vaccinated. If it got to the supermarkets, the persons who work in the supermarket would have been vaccinated. And so that is how we would stop the virus from spreading, and St. Kitts and Nevis will come through this pandemic without a single death.
Thank you, Dr. Wilkinson. The next question: if I am a football lover and I have done the right thing in getting vaccinated, can't we have a policy where persons who are vaccinated can attend mass gatherings like football?
I actually was asked that question when I went to one of the town hall meetings in St. Paul's by a gentleman, and I told him that I would defer the question to the CMO. And so I'm going to call it to bat here. But it's a good question. And if you were following sports, for the Super Bowl this year, the only persons who were allowed into the stadium were persons who were vaccinated. And so it's a very good point that is being raised, and there's going to come a point in time when you would need to show that you are vaccinated to get into places. I'm not just talking about here in St. Kitts, but there has been the discussion about a vaccination passport. And I can tell you that the US is planning to have the entire population vaccinated before the end of this summer. And once that has happened, you would hear that you would need to be vaccinated for you to travel. You would need to be vaccinated to attend certain mass events. And so that is where we are moving. And it might come a point in time when that might happen. I've heard persons from the entertainment sector already saying that they want to have vax parties where they would only invite persons who were vaccinated. The Center of Disease Control has said that if you are in a small gathering where persons are vaccinated, you do not have to social distance. I was at a function on the weekend, and every single person who was there was vaccinated, in other words, had their first shot already. And so it's important for us to develop these little small herds, because all that we're speaking about that we will get population one step. And so I was told one full basket, which means that we will get there one step at a time. And so we need to develop a number of little herds. And so you need to make sure that your little group is vaccinated, and the more of those persons become vaccinated, the more we'll be protected and the more we can.
Thank you, Dr. Wilkinson. Next question. If we had 20,000 doses, that's enough for 10,000 persons. If we are now at 9,241 persons getting their first dose, it means that we only have 759 doses left. At the current rate of vaccination, won't we run out of doses by next week? Dr. Wilkinson.
Well, first of all, let me say congratulations to the 9,000 plus persons who rolled up their sleeves and took the vaccine, and that is commendable. I know just a week or two ago, there was a talk about the expiration dates on the vaccine vials and whether or not we were going to be able to get persons to use up these vaccines, and if we were going to have to discard vaccines. And in the CMO's presentation that was done prior to the figures coming out today, she indicated that we were hoping to get to 10,000 by April 16. But rightly so, at the rate at which we are going, we would get, if we got no other